On today's show, Thrive Nation, we are joined by Dr. Bryan Ardis, who explains how the COVID-19 protocols that hospitals are required to follow are literally killing patients, including his very own father-in-law. Think about that.
Get ready to enter the Thrive Time Show.
We started from the bottom, now we here. We started from the bottom and we'll show you how to get here. Started from the bottom, now we here. We started from the bottom, now we here.
We started from the bottom, now we're on the top, teaching you the systems to get what we got. Colin Dixon's on the hooks, I break down the books. Z's bringing some wisdom and the good looks. As the father of five, that's why I'm a dive. So if you see my wife and kids, please tell them hi. It's the C&Z up on your radio, and now 3, 2, 1, here we go.
We started from the bottom, now we here. We started from the bottom.
Yes, 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 and yes. We are in the air everywhere, Thrive Nation, and today we are going to have a tough, rapid-fire conversation. Dr. Bryan Ardis, welcome into the Thrive Time Show. How are you, sir?
Thank you, Clay. It's great to be here. Thanks for having me on your show.
I like to keep the show fun. I like to keep the show light. I love life. I feel like every day that we are given is a gift from God, and what we do with that gift is a gift to Him. What we do with our day is a gift to God. You're an upbeat guy. I'm an upbeat guy. You're a successful entrepreneur. I'm a successful entrepreneur. But your father-in-law was recently, he passed. And I don't know if you wanted to describe his death as, how would you describe how your father-in-law died?
My father-in-law in February of this year, 2020, was actually killed by the hospital protocols that they used.
Killed.
I call it death by protocols.
How old was he?
He was 90 on the dot.
And seems irrelevant right now, but what is your medical background?
I am actually a licensed chiropractor, acupuncturist, and nutritionist.
How long have you been married?
I'm currently married for 5.5 years.
5.5 years. And have you ever had major issues with malpractice or things like that with your career up to this point?
Never. I've never even had a complaint filed against my license.
Have you been to jail?
Never.
Have you been under investigation in the past due to allegations of any malpractice that you weaseled your way out of?
Never. Not once.
Do you have anything you're trying to sell the listeners as a result of today's show? Are you trying to sell a product, a magic elixir? Are you making money off of a book you're doing? Is there anything you're trying to sell the listeners?
I'm not trying to sell anything.
So why are you putting your reputation at risk to share what happened to your father-in-law?
There was nothing I've ever experienced, and I've had multiple occasions in my life where there were traumatic events and moments that literally shifted my paradigm of thought and actually changed the trajectory of how I spent my time in my life. And the most dramatic of all of them happened in February when I watched my father-in-law literally be killed by the protocols that they were following in the hospital. And at that moment, there's been a lot of things that have changed how I directed my course of action and spent my time in life. Nothing has been more sure to me that there is a lack of education and knowledge with the lay people in this country to how the human body works, what the devastating impact of medications, poisons, and protocols are. And the hospital protocols that they followed, that I actually demanded them to change and they would not do, ended up in killing him, from him walking in 12 days earlier with a headache and a stomach pain. Within 5 days, he went unconscious from renal failure. And then by day 12, they convinced the family that they needed to overdose him on morphine, which eventually took his life within a 2-hour period. And he took his last breath in front of me. And from that time, I have been motivated to educate as many people as possible on what really is going on so that they can make better and informed decisions and protect their families and themselves from the horrors that can occur in hospitals.
There's a West Texas doctor who we recently had on the Thrive Time show by the name of Dr. Richard Bartlett. And he claims to have a silver bullet that, by the way, is made available and approved by the FDA. It's been around for a long time, But basically, you have a nebulizer that you use to distribute the actual steroid. Can you explain what Dr. Richard Bartlett is recommending to treat COVID-19 patients?
Yeah, I've actually watched his interview with Debbie on whatever that show was called. You can watch it on YouTube.
Yeah.
But I've actually watched the entire 30-minute interview about 4 times. And I love everything, and I support everything that Richard Bartlett is actually suggesting. He is suggesting that he has actually, since March, been prescribing a steroid inhaler called budesonide. It's a medication, and he's putting it in a nebulizer that people are just breathing in for 5 minutes. The steroid will suppress how much mucus your lungs make trying to clear the virus. So the human body, when a virus gets into them, your lungs, if it gets into the lungs, which the coronavirus does, your body will make mucus to try to entrap the virus for you to cough and eject it out. It makes it very hard for patients to breathe through this mucus. The steroid helps suppress how much mucus the body makes, and it's making all of his patients able to breathe. And then he's using an antibiotic and zinc supplementation, which he says is antiviral, which it is, to kill the virus. And within less than a week and after 2 treatments, these guys are testing negative, every single one of them, 100% of them.
Yeah, hundreds of people have been. They go in with all these symptoms. Their people are confirmed as having COVID-19, and they're getting better within days, sometimes hours. People aren't dying, and it's $237. So what I'm going to do now is I'm going to ask you a bunch of rude questions, and we're going to try to go rapid fire, kind of pick up the pace a little bit, and then I'll let you take us wherever you want to go here. And my wife is going to be with us on the show because she's smarter than me, and she, cares about our kids. She wants our kids to be able to go to school and safely do so, and there's a lot of conversations about masks and all this kind of stuff. So she's going to be able to ask you mom questions that women and people with a sound mind care about. But I want to get into the tough stuff right now. So, one, what did they do to your father-in-law? Where was the first fork in the road? Where did they go wrong as it relates to implementing a protocol that you believe killed your father-in-law?
First thing is, medical doctors are not free to make their own protocols or their own treatment plan. They are held to protocols in the hospital. He went in with what they said was the flu. I actually asked them to show me what positive tests for bacteria, viruses they found on day 1. Well, on day 1 in the hospital, they diagnosed him with the flu. He actually did not test positive for that at all. I actually saw the actual report. He also was not tested positive for any bacterial or viral pneumonia, which they said on day 2 of him being there that he actually now had pneumonia. So he went from the flu on day 1, which he didn't have, at least it wasn't shown in the blood report, to day 2 being diagnosed with pneumonia. I had them take me through all the chest x-rays they were doing daily for the first 5 days. And what actually happened was they gave him 3 antibiotics as a part of the treatment protocol for the flu. Just so you know, there's not a virus on the planet that dies from an antibiotic. Antibiotics are only created to kill bacteria. So why it is you would throw a bacterial agent called an antibiotic at a virus, I'll never understand. The problem is they put him on one antibiotic called vancomycin. Vancomycin is actually known, if you mix it with sodium chloride, is actually known to cause acute kidney failure.
Whoa.
Overnight, his kidneys shut down and he started accumulating water internally because your kidneys are responsible for eliminating water. And then his lungs started to fill with fluid, and he was diagnosed the next day with a chest x-ray that he had fluid in his lungs, and they called it pneumonia. It actually was never pneumonia. It was actually pulmonary edema, which means water-filled lungs. Each day for the next 5 days, they filled his lungs more and more with water as they continued these drugs. They did it for 6 consecutive days. By day 5, he was unconscious. By day 5, he was unconscious, put on a ventilator, and by 12, he was gone.
Did you ever try to intervene? Did you ever try to say, hey, hospital people, look, I'm a doctor here. Please don't kill my father-in-law. Did you ever have that conversation? Did you ever say, hey, quick time out here? Did you ever have, because you're seeing in the hospitals are being told that family cannot be with the patient. They need to be isolated because it's so contagious. Oh, it's so contagious. We need to isolate the patient. Did you ever have an opportunity to try to defend for your father-in-law's life and to speak truth into the situation and to intervene?
I actually got to be in the room day 7, 8, 9, and 10, and 12. And on day 12, they actually called security on me to have me escorted from the hospital because I got so irate with the doctors over several issues. But every day from day 7, I demanded them show me all of the records, and then I actually told them what they were going to do every day to improve his situation. The truth is, after 48 hours of my recommendations on day 7 and 8, his actual lungs improved, his breathing improved, his oxygen output improved, and intake improved. And then they convinced the family when I wasn't there that they needed to actually let him go and they needed to support him with morphine. And then they were convinced that the doctors were right. It was actually not true. He was not ready to die. He actually could have gotten better. But their protocols they held fast to, and then convinced the family they had to do what they said. I would love America to know you as patients in a hospital have more rights than a medical doctor does. You can fire them at any point if you don't agree with their recommendations or their protocols. You can demand a transfer. You do not have to do anything they say. And it is true, from the time he walked in, every day he got worse because of the protocols they held true to. And it ended up taking his life by creating renal failure. And that caused his lungs to fill with fluid over 5 to 6 days. Fluid got onto the brain. It made him unconscious. It was too hard on his heart. So they decided it was going to be best to just literally overdose him on morphine in a 2-hour period and help him take his last breath.
It's unbelievable. Who is making these protocols? Who's making the call?
Actually, most hospitals are actually governed by a CEO and a board. And unfortunately, most for-profit hospitals are not board members, are not medical doctors of any kind. They're typically MBA businessmen, and they're the ones who actually cast the protocols. If you ever want to learn something true about anything that I'm saying and you doubt it, I want you to purchase online a documentary called Life for Sale. And they follow 10 medical doctors who have been fired by going against the board when the board tells the doctor, you have to kick that person out now because their insurance has run out of coverage for the days they can be here for their diagnosis. And if the doctors kick them out early, the board says, we're expecting they're going to go home, they're not going to feel better, and they're going to come back. Because every time they come back, the diagnosis code for treatment allows them for an additional 4 or 5 days stay in a hospital based on the code. The truth was, a lot of people were dying when they went home because they believed the doctors who were letting them go were telling them that they were getting well enough, when in reality they were not. So this follows CEOs, boards of 10 different hospitals firing multiple medical doctors and taking their license from them when they would not follow the board's recommendations, when they stood for their patients and said they are not well enough to be dismissed. So if you want to know who's in charge, follow the insurance people, follow the board members, those who are making decisions on behalf of the business. It really is run as a business, and it's unfortunate.
You have, for every patient that is diagnosed as having COVID-19, there is $13,000 that is given to the hospital. And for every patient they put on a ventilator, there's also $39,000. $39,000 is given to a hospital every time they put a patient on a ventilator, and $13,000 every time that a patient is diagnosed as having COVID-19. But yet ventilators, people that go on ventilators, 88% of people that go on ventilators die. Why would hospitals, and again, I'm citing everything I'm saying, I'm citing here for the listeners out there. Again, this is an article you can find right now. This would be on Syracuse.com. 88% of coronavirus patients on ventilators died in New York. 88% of coronavirus patients on ventilators died in New York. Why would hospitals be given so much money to put patients on something that is so bad for them?
Clay, that's the exact question I've had for the last 20 years in practice. It makes no sense to me how this actually benefits any patient in the hospital. The only thing I can see is that it benefits those with deep pockets.
The Bill and Melinda Gates Foundation, these fun guys here. Bill Gates here. Bill and Melinda. Bill and Melinda, I'm typing this in here. Andrew, you can look at the screen real quick here. The Bill and Melinda Gates Foundation. Okay, they're going to make I'm looking it up, folks. You can follow along with me. Bill and Melinda Gates Foundation donates to CDC. I'm looking it up here. There you will find an article on CNN. Let me put an article. This is CNN. Some people think that it stands for the Communist News Network. I'm not going to say that. It doesn't stand for that, folks. But it says the Bill and Melinda Gates Foundation is donating $100 million to coronavirus relief efforts. And of the $100 million, you've got money going to the U.S. Centers for Disease Control. And Bill Gates is the one recommending the vaccine. Do you see a conflict of interest at the man who is talking about the models and talking a lot about how we need to have a shutdown, and the guy who's talking about a need for a vaccine is the very man who could benefit from the vaccine the most financially?
Yes, I see a problem with that. I also want to say and re-echo the words of Richard Bartlett, MD, out of Odessa. If you watch the full interview, he actually says it's a bad idea to consider a vaccine. And then he starts to quote what happened when we rushed to a vaccine with the polio epidemic and pandemic. What happened is, he says there's 10,000 people who immediately were given polio as a result of the vaccine.
What?
Another 100,000 plus were maimed by reactions of that vaccine, and none of us should ever rush off to do another one. I think it's a bad idea. Also, I think all vaccines are a bad idea because the CDC has very, very few expectations of pharmaceutical companies to supply information that a actual vaccine is efficacious. I don't know if you know this. It doesn't have to prove that it actually fights the issue that they're trying to vaccinate you for, or the bug or the germ. All they have to prove to the CDC is that it actually creates an immune reaction at the site of injection.
What?
That does not prove efficacy of any kind. So what pharmaceutical companies have actually figured out over the years is that if you want to elicit a reaction at the site by your immune system, the immune system does not react to attenuated or dead infections usually, which is what they're vaccinating you with a lot of times. So what they figured out is if you added chemicals and substrates to the vaccine itself and then injected it into somebody, the body would then produce an immune response to remove those toxins. Some of those are formaldehyde, some of those are mercury, some of those are aluminum, some are kidney cells from monkeys, baby monkeys.
Are you serious?
And I'm not joking.
How can you prove this? How can you prove this?
This is actually called adjuvants. Every vaccine has adjuvants.
Tell me what to type in. What do I need to type in, Andrew? I'm going to type it in. Look at the screen. What do I need to type in? How do I spell adjuvants?
Adjuvants is ADJU.
ADJU.
VANTS.
Okay, in vaccines.
Yeah.
Looking it up here. I'm choosing not to believe you because I don't want to believe you. This sounds great.
There's actually a textbook, a medical textbook out of Israel that came out 4 years ago. It is actually called Vaccines and Autoimmunity, and it's in all the medical schools in the Middle East, but it actually shows you every vaccine and every additive to those vaccines that have caused every autoimmune disease you can think of.
An adjuvant. You're saying what's in it again?
Adjuvants are what are the additives inside of a vaccine.
Oh, got it. Okay, got it.
Marisol, which is mercury. You've got aluminum that's put in some, formaldehyde that's put in some. There's a lot of chemicals added to vaccines to elicit an immune response at the injection site. And they know those chemicals do it, which is atrocious to me. But the real trauma from vaccines and the real danger lies in the additives, not the effectiveness of the virus or germ or bacteria they're putting in it. The actual threat is the added stuff.
Why would they put it in there?
Because it actually will elicit white blood cells to come to the area that they injected really quickly, and that's all they have to prove to the CDC is we injected them with this vaccine, and immediately there was a reaction at the site. Redness happened. Increased blood flow came to the area. Well, your human body's immune system will start to remove things that are toxic to it immediately. No different than like if you got stung by a hornet, immediately your body's going to send blood flow to the area. It will swell up. That is the reaction of the immune system. The CDC requires that there is just a reaction at the site of injection, and then they consider that to be efficacious, and then you can push it to the world. And it's erroneous. It's gross. I find it disgusting.
Talk to me about this. Should we wear masks?
Masks. Okay, so I'm going to quote Richard Bartlett again. He said, why in the world will we follow the recommendations of the communist country, China, and how we actually address this concern? Social distancing with the mask. This has not worked. It hasn't worked. It didn't work for Italy, Spain. It definitely is not working here. We have more than half of all the deaths of corona in the entire world in America right now, which is crazy. Even Richard Bartlett said, we have the greatest healthcare system in America. We actually don't. We just happen to have the most expensive one. Of all developed countries in the world, America actually is last as far as illnesses and diseases goes. We rank last among all 43 developed countries, but we rank number one in how much money we spend in healthcare. We really, really suck at helping to heal people and keep them healthy. We are very good at keeping them sick and then charging a whole lot of money for unnecessary screening tests, unnecessary vaccines, you name it. A lot of unnecessary protocols.
My brain is blown up.
This is me keeping it light, Clay.
Well, you think when you go to the hospital that they would help you. You know, that's what you're thinking. Okay, I go to the hospital, I'll probably get a little better in the hospital. You know, maybe that's why I'm going, is I want to get. But I found out that last year, and Andrew, I'm looking this up right now. If you can look at the screen real quick here. This is crazy. Medical errors are now the third leading cause of death in America, according to Johns Hopkins University. So you're like 2 times more dangerous, or maybe 3 times more. It's 3 times more dangerous to go to the hospital than it is to. You're 3 times more likely to die in a hospital than you are from dying from COVID if you don't go. Does that make sense? Like if you just are out there living life. Maybe 100,000 people die from COVID because they keep inflating the number of deaths. But you're 2 times more likely to die from just going to the hospital than from getting COVID. That's crazy to me. That is, I am. It's just disturbing. And so,
Clay,
yeah.
This is not a new stat, by the way. Since 2004, when I graduated from chiropractic school and started practice, I used to print the CDC's record every year, their annual report of every reason everyone died in America. And they give you your top 10 list also. Medical doctor error has been the number 3 cause of death since 2004 when I started printing these reports.
Man.
In fact, it's a panel of 10 people, including medical doctors and PhDs, that actually compile this whole list. And I don't know if you know this, but when they list number 1 is heart disease as the number 1 cause of death in America, and then cancer, and then medical doctor error, they put an asterisk next to medical doctor error. And at the very end of this 120-page annual report, it actually says, the asterisk represents that the panel is not sure that medical doctor error is not actually including the numbers of people that die from heart attacks and heart disease and cancer. And the reason why they state that is every known drug that is given to a human has side effects of cardiovascular risk and carcinogens. So they're not sure that medical doctors aren't responsible for all heart disease actual statistics and causes of death, or cancer. I always found that very problematic.
Okay, I got one more question for you, and then I'm going to turn it over to my wife, who probably has more practical questions, probably questions that make more sense. She's on behalf of Team Wise Woman. There, these moms, these women, they know more than us. So here we go. So, you keep seeing that the number of cases are greatly elevated. As an example, and Andrew, put this on the big screen here so you can see it. Just kind of zoom in here. Fox 35 Detroit reports Florida Department of Health says some labs have not reported negative COVID-19 results, meaning people don't have COVID. You say, okay, that's kind of interesting. FDA investigates lab as tens of thousands of COVID test results in Florida are questioned. You see, Orange County, I don't remember these kinds of controversies happening around the common flu. This is the LA Times. Orange County inflated its coronavirus test numbers by mistakenly including antibody tests, officials say. I just don't recall these things from typical flu seasons or typical other seasons. I mean, it's so politicized. Why are the numbers constantly overinflated? What's going on, Dr. Bryan?
Well, let me tell you some numbers I am actually very disturbed by. How many people in America have died when being treated for COVID? I don't know if anyone knows this, Clay, but before we get into our rapid fire questions from other people like Vanessa. Hi, Vanessa.
Hey, hello.
I want to make sure the audience is very clear about this. 3 days ago, I decided to look and see what was the protocols being recommended by the National Institutes of Health and the Center for Disease Control. I wanted to know what exactly are the government, or what is the government entities and agencies telling hospitals is the protocol to actually treat COVID patients. And to my surprise, when you go onto cdc.gov, it actually points you to the NIH website. And if you go to the NIH website, when you click on the link, it actually brings up their recommendations. And they are recommending, first thing, and only thing is the drug called remdesivir.
And who's
Have you heard of remdesivir?
And who's recommending this again? I just want to make sure I'm getting this.
The National Institute of Health, which I sent you an outline with the actual
Yep,
link.
got it. Okay, got it. Okay,
Also,
I'm
the
tracking.
CDC directs everyone on their site to go to the National Institute of Health. And on the National Institute of Health, it tells exactly what hospitals are to do protocol-wise with a COVID patient.
Okay, let me see it real quick. I want to go there.
The first and only treatment they recommend is remdesivir. And your audience needs to know about this. It's spelled REMDESIVIR.
Andrew, put the camera on this webpage here. So I'm on the CDC webpage here. I'm here. And I want to kind of go to where I need to click to learn about what you're saying. I believe you. I just have to
scroll down to clinical management and treatment.
Okay, clinical management and treatment.
If you type in COVID or coronavirus on cdc.gov, it'll bring this up.
We're not seeing it on this
clinical management
computer here.
Okay, I'm trying to find it here. I want to find it. Okay. What's maybe another word I need to search for? I'm going to find it. I'm a persistent guy. I see it. Clinical management and treatment. I see it.
Can you switch that film that we can't see what's on your screen?
Oh, you can't.
Yeah.
Oh, really?
See, we're seeing the other screen.
Oh, that's interesting. That's not a move.
There we go.
Oh, wow.
That's a move.
Oh, wow. Well, I'd say in editing we're gonna have to do a lot of work here, Andrew. Okay, so here we go. I'm on the site now. Okay.
So where are you at now? NIH or where are you?
I'm on COVID-19 treatment guidelines from the NIH.
Good. Do you see where it says, from NIH? Good.
Yep.
Now click on that. It asks you to go into the site. Did you do that?
Yep.
Good. Now you're going to scroll down and you're going to see an area that says, you're just going to see the word remdesivir. Do you see that yet? I'm actually going to pull it up here too. I'll tell you where you are. Hold on.
I see it. Yep.
Do you see where it says key updates to the guidelines and then go underneath potential antiviral drugs and you'll see remdesivir in bold. Do you see that?
Yep.
Good. It says here, recommendation for hospitalized patients with severe COVID-19 is that drug, remdesivir.
Yep.
Now below there, it actually will tell you a little bit farther down, it'll tell you not to use hydrochloroquine or chloroquine, right? But it tells you here to use remdesivir. Do you know what remdesivir is?
Is it a interesting flavor of yogurt?
I actually had no idea. I'd never even heard of this drug. So what I did was I actually went online to see what is remdesivir. Do you know that remdesivir is an investigational drug and it is not even FDA approved for anything in this country?
Wow.
This drug that the NIH and the CDC is saying we need to be giving to all of the people in America with COVID isn't even FDA approved or reviewed by the FDA. So what I decided to do was to go onto Google and I typed in remdesivir side effects and I went to drugs.com.
Okay, drugs.com.
So go to Google, just type in
I see it. I'm there.
Side effects, and then go there.
Okay, I'm there.
And when you pull that up, you pull up that site. It's insane to me what I learned just 3 days ago. I couldn't believe it. You're there, right?
Yeah,
so you
I'm
see
there.
the warning?
Yeah.
Go below warning.
Oh, boy.
If you're on that page.
Yeah.
And you see the side effects include?
Let me see here. Side effects include. Okay. Yeah.
And then you'll see randomized open label clinical trial. Do you see that beginning paragraph?
Randomized.
Further down.
Randomized. Oh, I think I've lost you. I think I was following you. I think I got off the Oregon Trail.
Just so you know, on the email I sent you, it actually has the link there. You can copy and paste it. It'll take you right to it.
Okay. What do I need to search for in that email to find it real quick, just so I can see? I got it. Drugs.com. I see the side effects. I'm on that page now. Yep, I'm just trying to track with you.
Right to that page, and it'll actually pull up for you.
Okay. I'm there.
And first, you're going to see warnings.
Yeah.
Don't read the warnings. Just go below there. There's warnings because no one knows anything about this drug.
Yeah.
But typically, these drug websites will actually give you a list of known side effects. Well, the FDA hasn't reviewed this drug, so there are none. So what they have included is, it says side effects include, and then they have 3 different clinical trials done on COVID patients in China. This is brilliant. And I want you to go down to the 3rd one. It actually says cohort of 53 hospitalized patients. Do you see that?
53. Yes.
Okay, so this is the last of the 3 trials. Let me just read this to you for all your listeners. This is all we know about this drug that they're given to every patient with COVID. Cohort of 53 hospitalized patients in the manufacturer's compassionate use program. That means the manufacturer of the drug did a compassionate program with 53 COVID-19 patients. Adverse effects, which included increased liver enzymes, diarrhea, rash, and kidney impairment and hypotension reported in 60% of the patients. This was over 5 to 10 days. So 60% of people had liver enzyme activities increase, kidney failure, and hypotension, which is low blood pressure that you could die from.
No, this isn't good. I don't like this.
Then it says serious adverse effects of multiple organ dysfunction syndrome, which means multiple organs are shutting down, septic shock, and acute kidney injury, which means your kidneys are stopping working, and hypotension was reported in 23% of people.
Stop it! No, stop. So why would because the National Institute of Health is headed up by Tony Fauci, right? Anthony Fauci, Dr. Anthony Fauci. Why would he recommend this stuff?
Oh, I just have to add some. It says the drug was discontinued during this 5 to 10 day trial. 8% of people had to come off of it because it made them so sick. So if you add up those totals of the 100% of people that went into this trial, 60% plus 23% is 83%. Add the other 8%, that's 91% of all of them had issues of kidney failure and multiple organ failure. And this is the drug of choice. Now, what's interesting too is if you read any reports from hospitals, administrators, medical doctors, you will hear them now say, now that we've been treating all these people, that they're finding it difficult to get not only ventilators for all of their patients that they're treating, they're finding they all need dialysis machines for their kidneys because all of their kidneys are shutting down. And they can't figure out why the virus is affecting the kidneys. I am telling you right now, America, the virus is not shutting down these people's kidneys and killing them. It has actually been reported in Science magazine that the number one cause for people dying is acute kidney injury during the coronavirus epidemic. The actual kidneys are being shut down by the actual drugs you're putting into there. Now, Vanessa's listening, Clay, you're listening. Let's try to make sense of this. Every time you've ever seen a drug commercial, you will hear this. After you hear them say, or right before you hear them say, ask your doctor if this drug is right for you. Every single drug, not just remdesivir, every single drug has this disclaimer. They will say, once you start taking this drug, make sure your medical doctor checks your kidney and your liver functions often. Do you know why they say that?
Because it's a toxin and it damages it?
Because every single drug has to be filtered through the liver and the kidneys for excretion, but they damage those organs. And what happens is their enzyme activity will start to go up, which means the organs are starting to fail. And then the doctor then has to switch you off that drug to put you on another one. This is the game of Russian roulette you play with drugs. My problem is you now have another drug that's being pushed as the number one recommended drug to treat COVID that is not FDA approved and has not been proven in Chinese studies to actually be beneficial. It actually shuts down organs, stops their kidneys from working. And just so you know, when they talk about when they talk about pneumonia occurring to corona patients, the same thing is happening that happened to my father-in-law. They put him on drugs that shut down his kidneys. His kidneys no longer could eliminate water. The body would then start filling up with water. The lungs fill up with water. You can't breathe, and then you die. But they call it pneumonia, but it is not. Pneumonia is different. It's an actual infection in the lungs. These people are being drowned to death by having their kidneys shut down by this drug.
I wanted to share this with the listeners, and I'll let my wife. Then I will let my wife ask you some questions. On the CDC website, it lists out all these different potential symptoms. Andrew, I'm just reading this so you can look at this big screen here. It says, people with these symptoms may have COVID-19, a fever or chills. Well, I get the chills every time I watch the news, pretty much. But the cough. I think allergy season, people get that kind of thing. I mean, you've probably seen that. A shortness of breath, fatigue. I'm fatigued every time I hear about anything on CNN or anything that's on ABC or NBC or CBS.
Also has 5 kids, so.
I have 5 kids. There we go. Muscle or body aches. I mean, I'm approaching 40, so things hurt. A headache. I get headaches when I think about the COVID and all this ridiculousness. Congestion, nausea. I just got nauseated. I really did. I got nauseated listening to what you were saying there. There's so many different. There's new confusion.
What is new confusion? That is yet to be described. Or
inability to stay awake. I mean, you take me to a pretty slow-paced Lutheran church, I'll fall asleep right there. So all I'm saying is there's a lot of symptoms. There's so many symptoms, and it says here, people with these symptoms may have COVID-19. And that's where I'll kind of tee it up for my wife. Vanessa, what questions would you have for the good doctor about all things medicine, COVID-19, just anything at all,
Yeah.
being a mom and this craziness? What questions would you have?
Well, actually, this has to do a little bit, with Dr. Bartlett's interview that you did the other day. Correct? Is that who it was, Bartlett?
Yep, Dr. Bartlett.
Okay, so very exciting, and I know that Dr. Ardis, you referenced earlier, just, obviously he's been doing a protocol and treatment, and he's had 100% success so far. And I was visiting with someone who currently works in the hospital, and I need to read my little notes here. They said that that treatment makes sense to them. This is someone I'm visiting with who has asthma, and they're like, hey, this makes so much sense. And actually, it's her daughter who works at the hospital. And she said, my daughter said they would never be allowed to do that. And I was like, why? She goes, because they actually cannot, it's another protocol thing. She goes, they actually can't prescribe, I guess she's saying, what needs to be prescribed. They would have to have their primary care physician prescribe that. So my question was, I thought, well, then just go to a primary care. She goes, well, many people don't have, and I get that. I know Clay never goes to the doctor. I thought, well, you still could just go to one for the first time. Well, my question is, how do we fix that so that the everyday person who is needing treatment, and this does seem like a valuable treatment, how can they fix that so that they can actually get prescribed that by someone instead of, like you said, it's like there's a treatment available and yet they're denied because the protocol. How do you work in that system?
Okay, so one thing is the protocols are what the doctors are bound by in the hospital. I did mention earlier in this interview that, and I've mentioned it many times, but you as the patient, most patients don't know that they have more rights and can demand of their medical professionals in a hospital to do something different. That doesn't mean they will, but you can demand them do that and not do their protocols. And you can ask for something different. There's been extreme cases where people actually have to sue hospitals to get other types of support or treatment that they don't agree with currently that people are trying to offer them. So the first thing is I would demand them actually do Richard Bartlett's protocol. If they don't, I'd walk myself out.
And
I would just say this: people will be better off if they don't go into hospitals.
And so this is so for my friend who was concerned and said, well, I don't think I could do that because I don't have a primary care physician. It's not like you have to have a history with one. You could walk into one that you've never seen before, correct? And say, I need to be seen today. I'm a new patient, correct?
That's exactly right. That's exactly right.
So it's not like you have to have one on Clay hasn't been to one for probably our entire marriage, right? Maybe one time in our urgent care.
Not going.
But
Same.
if something happened to him, it's not like he would be denied because he doesn't have a primary care physician. We would say, you know what? We don't think it's wise to bring him to a hospital because we don't want to be under these protocols. We're going to go to call up someone, right? And then
That
say,
is
we
exactly
would like doctor. Okay. So I just want for the listeners to know what the
Yeah.
action step is they take to get this treatment. Because I'm being told that if they go to a hospital, it's going to be harder to go that route. They're going to have to leave and go find a primary care physician. Is that
There's
correct?
a few things I would like to also expand upon on your comment. I absolutely agree. People should not do the hospital protocols or go to the hospital. They would be better off if they went to a primary care doctor. And anyone who actually did not open their doors to help support somebody, their license should be revoked or complaints should be filed for sure. They should be making themselves available to people. Number two, I don't agree with everything with Richard Bartlett's interview, particularly the use of the antibiotics. So I would actually say, I will just tell you now, the thousands of patients that I've had over the last 15 years, none of them would even go to a primary care doctor. They all emailed me during this COVID period to know what would I do.
Quick
without
time out.
medication.
Quick time out. And I hate to interrupt you. I just want to ask you a question. You don't agree with everything that Richard Bartlett said, but the main cure that he recommended, you guys are on the same page. The main treatment.
You better believe it. If you're going to do any medical treatment, you should follow Richard Bartlett's protocol.
Okay, so you believe that, and now
Yes.
what you're saying is the antibiotics. Back to you. That you're saying there you don't agree.
Right. Yeah,
Okay.
The only reason why I don't agree with that is because there is no evidence of a bacterial infection. You should not throw antibiotics needlessly into a body that doesn't have a bacterial infection.
Got it.
Coronavirus is a virus. It doesn't respond to bacterial infections, but he said he uses it to try to protect from the effects of pneumonia that can come behind the coronavirus, which could possibly be bacterial, but unwarranted. I wouldn't throw that at anybody. But what I would suggest is what he actually does. I agree totally with the steroid treatment. I agree with the bacteria, the actual antibiotics, only because they are FDA approved. Why are we not trusting that system as a whole. Trust the FDA-approved drugs, hopefully, more than anything else. And then the zinc, everyone should be taking zinc, 80 milligrams every day. Even Richard Bartlett said it is proven to be antiviral. It has been shown for decades to stop viruses from replicating. It literally suffocates them to death, and it deprives them of oxygen. So 80 milligrams, everybody should be on it right now preventatively, and they should stay on it even if they got COVID. And then there's just a few vitamins and minerals that support the immune system to actually kill any virus, and it will do it.
Vanessa, I will give you the final questions. I mean, you're again, there's a lot of women out there, a lot of moms who are trying to make healthy decisions for their family. They're considering sending their kids back to school. I frankly have no idea what the female mind is thinking, but she does. So I'm going to turn back to you. Do you have any other questions that you think that other moms would want to know? You're seeing maybe people emailing you, texting, anything you're hearing just that you'd like to ask?
Well, that was the main thing first about,
Okay.
I was so impressed by this treatment. And then I was a little bit discouraged when I heard someone say, but there's no way that we could get that. And so I just wanted to talk to a doctor and find out, I know there's an open door some way, what is the way? So thank you for answering that question. I know where I stand on it, but I guess just for the sake of our listeners, coming back to masks, if you could just touch on that one more time.
Well, the lady at the suit store couldn't breathe. This lady's wearing a mask, and she seriously can't breathe. She's like sweating. I felt horrible for her.
Bad.
There's another guy working the front desk, like coughing. And I said, homeboy, you can take off your mask if you want. It's just me, because there's just me in the store. And he goes, you serious, sir? I go, yeah. And he was like super worried that I was going to catch him or something. I said, hey, I put my phone down. I said, here, my phone's down. Boom, here it is. I'm not going to film you. And he's like, dude, seriously, I can barely breathe. I mean, so I just know anecdotally, it's a ridiculous exercise to wear a mask.
Well, I'll give you my thoughts on that, Vanessa. I actually don't agree with the mask things as a whole. I don't think it's a smart idea. I don't think it's beneficial at all. But I have to tell you something I found ironic. My wife's daughter is an occupational therapist and works in a hospital that does have a COVID unit down in Houston. And over this entire COVID period, all of the OTs, all the nurses, all the doctors are required to wear a mask while in the hospital. I found this insane, but last week she reported to us that the hospital is actually recycling all of the masks every day to different people. They collect them and then hand them back out, the same ones every day, and have been doing it this whole time.
That's disgusting.
So this is a question because I've been asked this.
Gross.
That's great.
So some people say, well, what about people who work in hospitals and who wear masks all day? How have they been doing it this time? But I feel like maybe I'm wrong because I could very well definitely be wrong because I have never worked in a hospital. But do they wear masks all day? Because I thought maybe they wear them when they're doing a surgery, but then they take it off. Or how does that work now that we've been introduced to wearing a mask and how uncomfortable it is? Are people for 8 hours a day, 12 hours a day who work at hospitals before COVID, were they wearing masks?
No, only the surgeons, when they had a
That's what
body
I
they were
thought.
cutting open, were required to wear masks.
And then they would take it off so they wouldn't get their germs falling into.
Yeah, they wouldn't want anything airborne or any blood coming in their mouth, right?
Oh, man. Well, I tell you what, you guys are blowing my mind. And I know people are going to want to know more from you. They're going to want to maybe ask you questions. If somebody wants to, this is life or death stuff. Someone has their father-in-law in the hospital, their mother-in-law, their child, their whatever. We know that 99.2% of all the deaths in Italy were elderly people with a deeply compromised immune system. My final question is for you. Is COVID something that I, as a parent, should be super worried about for my 5 kids?
No, it's not, Clay.
Well, there you have
I'm
it.
not worried about my own kids. I have 5 kids. Youngest is 8. I'm not concerned at all. And the reason why I'm not afraid and I'm not concerned is I actually know how to actually protect the body from taking on viruses and helping it heal without dangerous drugs destroying the body.
Jason, you have the. I guess I'll let you ask a question because you have a lot of people that are impossibly scared
Very.
of COVID-19.
Yeah.
They're just just the thought of COVID-19. You just say calm down, calm down. They get
Frantic.
They're frantic. They're dressing up like astronauts, going out when they're going out with their friends. They're wearing all these masks and all these weird. I don't know what they're doing. They look like an extra from Back to the Future,
That's
where
true.
Doc Brown's trying to go back to the future with his nuclear suit on. They look
yeah.
like they're Lance Armstrong going to the moon. They look like they're an extra in some sort of sci-fi interstellar movie. What question would you have for Dr. Bryan Ardis as we wrap up today's show?
Well, It's kind of a two-part question. So the first is, so you mentioned how it's important that you take zinc. So I take zinc and magnesium and vitamin D3 every single day. So every morning I take D3. Actually, I take that 2 times a day. And then when I go to bed, I take my zinc and magnesium.
You look like you've been taking your zinc and magnesium.
Oh, yeah. But is there anything else that like people should just be supplementing with naturally as opposed to taking all of these over-the-counter procedural drugs that we know for a fact are going to ruin their kidneys and potentially put them in the hospital? Not potentially, will put them in the hospital and then mark them as another COVID death? Like, what could people be taking right now, since immune health is something that's super important that nobody's touching base on?
Yeah, there's several things. I will just tell you, the human body is incredible. I believe God created the human body with an immune system to handle everything, including viruses we were going to experience while on this earth. It is very true. There's actually a guy who actually won 2 Nobel Prizes and figured out that vitamin C kills the flu virus. I mean, how brilliant is that? So I would recommend people take vitamin C. It's proven to be antiviral and support the immune system. I would actually recommend like 5,000 milligrams a day. Wow. If you think it's too much, you'll know it's too much when you get diarrhea, then just back it down. But that's what I'd be taking preventatively. And then I would also encourage people like you're doing. Jason, you're taking zinc every day. You need to be taking at least, I would say during the COVID fear worry, 80 milligrams a day, at least 50 milligrams. But if you're sick, you need to be taking 80 milligrams of zinc. The third most important thing for your immune system is actually selenium. And most people don't talk about this, but selenium and zinc are required to make antibodies that are known to kill cancer cells and viruses in the body. And your thymus gland that sits right behind your sternum is responsible for making those things. And it needs selenium. Everybody should be taking a minimum of 200 micrograms, mcgs, of selenium every day. When they're sick, they should double that up to 400. So I would recommend vitamin C, zinc, and selenium to actually help combat any worries or fears that people have. And I would, again, echo Richard Bartlett, the medical doctor out of Odessa. He actually said, for all Texans, and I'll say for everyone in America listening, there really is hope, and you don't have to be as scared as you have been led to believe. The human body can handle it. You just need to be prepared and educated with real answers. Richard Bartlett's got an answer. I'm sharing with you some answers. And your body can recover and heal from COVID.
You know what? I just want to add in here. I wish, with the same passion that we're preached to about wearing masks, that we would hear that message out there for everyone to say, hey, get your kids on these vitamins. Hey, why don't you guys go out and take these? It's sad to me that you don't hear that mainstream. Just the passion to, hey, go get on these supplements to help build your immune system.
If you watch ABC or NBC.
You can still do a mask if you want. I'm not saying you can't, but I just wish that. Why can we not hear this anywhere?
Because if you're watching ABC or NBC or CBS or CNN, every, third commercial's like, today's programming is brought to you by yada, yada, yada. And then it's like always a picture. It's like classical music. Jason, you know what I'm talking about. Let me cue it up here. It's like this classical. Let me get it. Let me.
Are you suffering with depression?
Yeah, let me cue it up here. This is what I'm talking about. It's like here we go. Are you suffering from depression? Do you have a mild headache? Take yada, yada, yada. Now, yada, yada might cause anal bleeding, nasal bleeding, rectal bleeding, which is the same thing as your anus, but I like to say it twice. It might cause shrinkage. It might cause your brain to explode. You might die in a dramatic car accident. But see if it's right for you.
Ask your doctor today.
Ask your doctor today. Every commercial, it's the same. It's like just constant. Big Pharma's out of control. Out of control. Dr. Ardis, thank you for being on the show, my friend. I love you. You have nothing to sell us, but you got a lot to tell us. Thank you so much. And again, what's your website? How can people get in touch with you?
If you want to actually learn more about my COVID recommendations, about 3 months ago, I did a COVID podcast of my own at Facebook at drardisshow.com, DRARDIS show on Facebook. Sorry, there's a page on Facebook. You can go find that.
Okay. Well, brother, thank you so much for being on the show. And I'm going to keep you after today's show because my wife has some more questions for you.
Awesome.
Take care. And now, without any further ado, 3, 2, 1, boom! Carl quit chafing, scratching, itching, and burning with Semantics and support. Talk to your doctor about Semantics and the right support plan for you. Some people have had changes in behavior, hostility, agitation, depressed mood, and suicidal thoughts or actions while taking or after stopping Semantics. If you notice agitation, hostility, depression, or changes in behavior, thinking, or mood that are not typical for you, and if you develop suicidal thoughts or actions, stop semantics and call your doctor right away. Talk to your doctor about any history of depression or other mental health problems which can get worse while taking semantics. Some people can have an allergic or serious skin reaction while taking semantics, some of which can be life-threatening. If you notice any swelling at the face, mouth, or throat, or a rash, stop taking semantics and see your doctor right away. And tell your doctor which medicines you're taking, as they may work differently if you are Caucasian, Asian, Samoan, African American, Northern Canadian, or from California. Dosing may be different if you have kidney problems or an enlarged cranium. The most common side effects are nausea, depression, rectal bleeding, testicular shrinkage, visual impairment, loss of life, chronic fatigue, diarrhea, and skull implosion. Patients also reported trouble sleeping and vivid, unusual, or strange dreams. Until you know how semantics may affect you, use caution when driving, operating machinery, or speaking to people that you know. Semantics should not be taken in conjunction with quit smoking products. Call your doctor to see if semantics is right for you.